Welcome to InSight OnSite. I'm Wendy Brokaw, and we are on site at the new Bridgeway Community Health Medical Center, where they are bringing primary care, medical detox, and patient services to one campus.
So 2009, we were just coming out of a economic crisis nationally, actually a worldwide economic crisis, 2008. And there was a need in our community for an organization to focus on people struggling with symptoms of mental illness and addiction. So I was asked to start a new nonprofit, and that's where Bridgeway Recovery Services was born in 2000. Actually, born in 2008, we started services in 2009. There was about 40 people who worked for Bridgeway, and we saw a couple hundred people a month. Now there's well over 200 people working at Bridgeway. Bridgeway evolved to Bridgeway Community Health as a result of the fact that we started seeing our mission grow and be bigger than just recovery addiction. So we have primary care, we have dental care, we have a social service piece of our organization called Bridgeway Community Connect. So Bridgeway's really grown, and now we see over close to 1,000 unique patients every month.
We've already started expanding what we were doing in terms of care. So Tim had a vision about primary care and the need to meet individuals' holistic needs. And in our strive to meet the social determinants of health and to help overall wellness of individuals, we started looking at housing. We started looking at dental care and partnerships. So we began looking at care as a holistic goal and a holistic view. So then it went from Bridgeway Recovery Services to Bridgeway Community Health.
So Bridgeway for years has had a small detox clinic that we have out in the north end of Salem. And there was a need to add more additional beds. And I wanted to bring that center into town and join it with our outpatient building, which is what we're in, so that we have a Bridgeway campus in the middle of town, middle of the community, not on the outskirts, that serves our outpatient folks. That's going to have a detox clinic for people that need that level of support. We're going to have a primary care clinic, and we're going to have a sobering service, which is a different type of service that Salem hasn't had. So all that's going to happen right here on this campus, right downtown, right by, with a sign on all night that says Bridgeway. I really want this to become as normal as possible.
Why bring all of these services, the medical detox, treatment, and recovery services, under one roof?
Well, part of it is to make it normal, is to reduce stigma. You've heard me say before that I want going to treatment to be as ordinary as going to the dentist. And we've worked on that. We've reduced stigma considerably. No longer do people park behind buildings and hide, and no longer do they get anxious about, and sometimes it's even our staff used to be anxious about going to work. It's pretty normal now. You know, the word is out that people struggle with addictions in all sorts of levels of our community. And we see people at all levels of our community coming to Bridgeway for support. So that's good. That's made it easier to seek treatment, and then we can provide treatment. And by having everything on one campus, if someone were to come in here for detox, which is an inpatient service, when they finish that stay, which could be a short 5 or 6 days, they can walk right across the corridor and meet their outpatient counselor right on that same day. And so the handoff from inpatient to outpatient is seamless and supportive. And that's why we wanted to co-locate all of our services on one campus.
We are putting a lot of intention in our development of our new building. So one is trauma-informed. Two is demonstrating that we care. It's not seeing them as the problem, but a person in need. And we want it to be reflective that we are doing this with love and compassion and care.
It fits the goals of being part of, and you know, it's not exclusively our domain, but being part of services that support the community, and particularly people that are struggling with symptoms of mental illness and chemical dependency addiction, problem gambling addiction as well. So, you can call it the Fred Meyer example. It's one-stop shopping. You can come onto this campus, and whatever your level of need is in those realms, mental health and addiction, you're going to be able to receive treatment here.
What I have experienced throughout my years at Bridgeway is that folks feel the sense of connection that Bridgeway has had in this community, and it's been like a cornerstone. And for some, anecdotally, what we hear is that it changed their life. So much so that they dedicate a new purpose in wanting to help. So so a lot of our clinicians have lived experience about many challenges in life, and now have repurposed their life to helping others. So that is reflected. So it's not just us and the community. We are the community reaching back and helping others that are still in need.
In 2009, it was really innovative. There weren't many people doing what we were doing. We understood the role of trauma in the lives of people that are struggling with psychiatric illness or with addiction, and we've been really trauma focused to help people understand how that contributes to what their life experience is going on for them. So that's been part of it. But then there's also just this focus on the environment of care, make it comfortable, making it accessible. We're downtown, we're on a bus line, it's easy to find us. And then when you come in the building, like you said, it's full of beautiful rooms with Northwest artists contributing to the art that you find in the place. So everything about it is about making people feel safe.
So we're here in the main entry of the new medical center for Bridgeway. And so what we'll have here is the main entry. There'll be a staircase that goes there to upper level. And then this will be the entryway into our primary care clinic. And then over here, you will see a separate entry and a separate waiting area that will be for the admission to our medically managed withdrawal unit. This is standard medical office, right? There's exam rooms, there's counters for the MAs and the nurses. That's a waiting area, that's a changing area. But the real business end of it, and so what we're trying to provide is going to be upstairs and in the culinary department for John, because that's part of the whole recovery experience. So
this is our kitchen, and I'm really proud of this. This is something that's been years in the making. At this point right now, we work out of a kitchen on Harold Drive, which is about 600 square feet, and we serve roughly 300 meals a day there. By the time we get done with this building, we're going to be looking at about 420 meals a day. And so we want to make sure that our clients get the best experience. A lot of our clients have never had the type of food that we serve, and the things that we do with culinary are there to help the clients. I mean, we get people with food that are food fear, people that haven't eaten for a long time, people that are even diabetic. We have a medical forms that we take care of. We take care of people that way, right? We make sure that we watch their diets. We make sure we work with them. And the biggest thing is that we want to be able to give the clients the same experience that they would get, say, if they went out to dinner or they did whatever. This may be the only time in the beginning of their recovery that they get to have this type of an experience and the type of food that we do. Our executive chef, Lisa Hunter, has put together amazing menus, and we put together 30-day menus that rotate. And so there's everything from salmon to prawns to chicken breast. We have smoked brisket. I mean, all the things that you would have in a restaurant. Tim Murphy has been a good friend of mine for a long time. And when I came to work for him, I had just gotten out of the restaurant business, basically. And what he wanted me to do was bring that experience to what we do culinarily. That's what we've done. And we want to give, like I said, give the clients, the patients that experience, but also the part about the nutrition and all of that. I have in the past taught a class to detox student or detox clients about nutrition, about certain kinds of food that they should be eating to help them through their recovery. And I even have people that see me on the street now and, hey, I remember what you said, I'm doing this or I'm doing that. So it's really important. The food end of it, the culinary end of it is so important. And with this kitchen, we've got a bakery, everything will be done in-house. But the one thing that I want everybody to understand, okay, this is for the community. Everything that we do here, I get up every morning, I come to work for the community. The community being our clients, our patients, and the people that come to outpatient, all of it. And we all have learned experience, I think, pretty much all of us, and that's really important. And so the biggest thing I can say is I want to thank Bridgeway for giving me the opportunity to be able to design this, put this in place, and it'll be great when we get going. And we'll be putting out some food that I think everybody will enjoy. I'm pretty sure they do. They do now. It's one of the things that people really talk about when they come in to detox. They've heard about the food, or they've been here before, and they like the food, or when they're leaving, hey, the food was great. So the nutrition part of it is very important. The education part of it is very important. And that's what this is all about. Just a big wrap around the community to give people the nutrition, the good food, and the experience that hopefully helps them on their way to start recovery.
So we're here right now in what is really the main milieu. This is their living room, right? So when I was talking downstairs about how we designed every single aspect of this building with the client experience in mind, this is the main area. This is, a place to just relax, a place to feel comfortable. There will be a nurse's station over there. You really can't see that, hasn't been finished, but they will be right here. The nurses will be able to observe and help them through whatever symptoms they're going through. So we're really focused on managing major medical withdrawal symptoms, right? We're really working on making them comfortable while they're going through any withdrawal symptoms that they might have. So these are really our acute rooms. So these rooms will have hospital beds in them, right? So let's say they have a CPAP machine, or they are really having severe withdrawals. I mean, our whole focus is really help manage people through severe withdrawals. But they may have other particular medical needs that they need a hospital bed, they need to set up, they need to lay back, they need to have more quiet. And so it's for their comfort and for the comfort of the other, because I don't know if you've ever been in the same room with the CPAP machine, but they're kind of noisy. So we want to be able to give them a quiet place too. So acute rooms, and then these are just more of our standard living rooms. We'll also have a really safe place to relax, right? So there'll be some chairs here around this fireplace, a TV, there'll be some tables over in this area. Sometimes just will help to just relax, and they put puzzles together, and we have some crafts that we can do to kind of occupy their time because they're really not feeling good a lot of the times. And then around this area, you'll see over here as an outdoor area, so they can get some fresh air, they can get a little bit of exposure to outside. There'll be some comfortable seating out there as well. There is some room specifically designated for our female clients because we really want to make sure that they have a safe place to be. Our current facility is more of a mix and match of everybody, but we know that every individual has different needs, and so that's important to us to have an area over there for them. We'll also have some group room areas. We will see the dining room down the hall. There's some area there for snacks throughout the day, throughout the night, if they're feeling hungry. That really helps them. As John was saying downstairs, food has a lot to do with comfort and a lot to do with recovery. So they'll be able to get snacks anytime during the day. In addition to that, another big piece of our program will be to do some transition planning. So as they're feeling better, we'll start working on transition planning. So are they interested in going to our residential program? Are they interested in going to our outpatient program? What is their real interest? And so we will help, the counselors will be here on staff, and they will help them develop a plan for whatever they see in the future, whatever kind of recovery they want to see in the future. Sometimes people aren't ready for that. So they will just manage the withdrawal symptoms, and we will give them resources, and we'll give them whatever we can to help them plan that journey. But the key here will really hopefully be to transition folks smoothly to outpatient services or to residential services. But this facility is made every decision with the client experience in mind. So every decision that we've made, I mean, the colors, the privacy that you'll see in this area, this is clear glass now, but it will be filmed, smoked out so that it's private. So you can wait for your service in private and not in the middle of, of traffic. But the colors, are they calming? The artwork will be calming. Every decision that we made is really with the client experience in mind. This is a community project. We worked with local architects, local construction workers, local community partners to really develop this for the ultimate, hopefully, client experience for recovery. And detox is really the beginning stage of recovery. Sometimes people come in, they're not thinking about long-term recovery. They're not thinking about that because they're thinking about is that they don't feel good and that they're having withdrawal symptoms and they're struggling. So we want to be able to, with this facility, add the full spectrum in. And a lot of times that full spectrum will start with our sobering beds. They don't have maybe made up their mind yet that they want to commit to treatment. They may not have even decided that they want to really struggle with the withdrawal symptoms and the withdrawal process. So with that aspect, we could put them on our sobering and we could keep them in sobering for a period of time. Hopefully at the end of sobering, then we'll be able to meet with the counselor and hopefully motivate them to come up here to this level for some withdrawal services. So really it's whatever their need is, whatever their plan is. We'll help them put together a plan. It's really their plan. And they're free to leave anytime they want. And anytime that they're ready to leave, and we'll have staff here to help them transition back, whether it's just a ride back home, or maybe they just want to, finish up here and maybe they want to go to the mission, or maybe down the street to Arches. Whatever their plan is, we want to support them and develop that plan. So they don't have to stay here. Nobody has to stay here any certain amount of time.
One of the biggest obstacles to access historically has been stigma, particularly in our field, mental health and addiction. And so normalizing treatment, making it easy to find. You can walk in here and ask for an evaluation. You don't need a doctor's referral. If people feel they need a detox service because of either alcohol or drugs or prescription medicine, they can walk in themselves and ask for an evaluation and assessment. They'll get that evaluation assessment will be given to them and said, here's what we see, here's what we recommend, and then it's up to you, Wendy, to decide what you want to do with that information. If you want to seek treatment, great, we'll set you up and we got you going. If you want to think about it yourself, that's fine. If you want to get some community support like AA, NA, GA, that's Alcohol Anonymous, Drug and Gambling Anonymous, those are available and we can resource those services to you.
Historically, there's been a lot of, as you mentioned, stigma about how we treat individuals that have either mental illness or substance use disorders in our community. And some of that has been deconstructed through the decades, and we're at a point where it's gaining additional attention. And Bridgeway, historically, with the vision that Tim had from a trauma-informed care lens, we have been looking at substance use disorder and mental illness and behavioral health as any other illness that you would seek a medical provider or just as another need that a community member is seeking. So we're normalizing the need to be able to talk to somebody when you have any sort of need or care. The other aspect that I think is important is that we look at healing as healing the wounds of the soul, so soul wounds. So I think it's important that we look at behavioral health as sitting in spaces with compassion and care and helping others move towards wellness, not just something being wrong with them, but they're needing to heal from something potentially.
Some people come to us very scared. Some people come to us with a court order. Some people come to us with a wife or husband mandate, partner mandate. It just varies what comes in. And we want to be able to meet whatever that anxiety is, whatever their concerns are, and show them that it's not a scary place. It's comfortable, it's welcoming. We respect you for making the decision to come to treatment. We honor you for that. We know that it's hard. It's really a hard decision to make sometimes. And we're here to support and give you whatever we can to make it easy for you.
We don't recover in isolation. And not to get on my pedestal, my little soapbox, but there's been some research, a lot of research done, and some meta-analysis, sorry, I want to do it for a little bit, that reflects that the more community support, natural supports, family members that are involved in the healing process, the greater the likelihood that person will get well and stay well. So part of what we do purposely is seek out what does your community environment looks like to help you on this journey. So we welcome, I believe that it's an integral part of our process to involve family, involve friends, or if they have somehow been estranged from those circles, how can we establish and forge new ones that could help you along this journey? It makes it that much more harder if you're doing it on your own.
We see us as a vital part of the community. We've tried to make it easier for people to understand that it's okay to seek treatment. And when they decide to seek treatment, we make it as comfortable as we can for them to pursue treatment.
Most of the work that has been done and continues to be done is by community members. So I think just knowing that we're here, that we care, and that if you have a loved one or a neighbor or a friend, that it's okay to reach out and seek out, the help that they may need. I believe that our goal is to continue to provide care to our community. So since then, we have expanded our outpatient services to help those in rural communities. We also have expanded our capacity in medically managed withdrawal, as well as our residential care. And as I had mentioned earlier, looking into stabilization and housing, and again, wrapping our arms around our community members to support them in this journey. And we continue to develop partnership in expanding care. One of the newer pieces is our Bridgeway Community Connect, which was funded through the Behavioral Health Resource Network under Measure 110. And what it does is provide access and low barrier access to individuals and helps us forge relationships. Even if the individual doesn't seek treatment at that time, they know that they could come to us for help. So those navigators and care coordinators can help individuals connect to other resources such as housing, Social Security, employment, even if they're not seeking treatment at that time. They're not obligated to be our clients. However, if they need care, we offer an assessment within 24 hours and make the appropriate referrals. They could choose us or any other provider.
Well, I'm just really excited that you guys are here. I'm looking forward to the medical center, and we walked through it a few minutes ago, and you saw it's kind of dirty still, but it'll be done. It will get done, and then we'll have this very dynamic campus right in the middle of this community, and I'm proud that this community has been so supportive of what we're doing.